Let's talk about an uncomfortable but common experience for many women: vaginal yeast infections. You're not alone if you've ever felt that dreaded itch or experienced unusual discharge. This is a safe space to learn about what causes these infections, how to recognize the signs, and most importantly, how to find relief and prevent future occurrences. Vaginal yeast infections, also known as vaginal candidiasis, are incredibly common. It's estimated that nearly 75% of women will experience at least one episode in their lifetime. While the symptoms can be frustrating and uncomfortable, the good news is that yeast infections are highly treatable and manageable with the right information and care. This guide will provide you with a clear understanding of vaginal yeast infections, empowering you to take control of your vaginal health. We'll explore the causes, delve into the symptoms, and discuss effective treatment and prevention strategies. Remember, knowledge is power, and understanding your body is the first step toward feeling your best. Let's get started on the path to a healthier, happier you. The star of this story, unfortunately, is a microscopic fungus called Candida. Don't let the word fungus alarm you. Candida is a normal resident of your vagina. It usually lives peacefully alongside other microorganisms, contributing to a healthy vaginal environment. The problem arises when the balance in your vagina is disrupted, allowing Candida to multiply rapidly. This overgrowth is what leads to the uncomfortable symptoms of a yeast infection. Think of it like a garden. When different plants are in harmony, the garden thrives. But if one plant starts growing out of control, it can take over and disrupt the entire ecosystem. The most common type of Candida fungus responsible for these infections is Candida albicans. It's a bit of an opportunist, waiting for the right conditions to flourish. Understanding Candida's role is key to understanding why yeast infections happen and how to prevent them. In the next section, we'll explore the factors that can tip the scales in Candida's favor. Candida thrives when the vaginal environment is thrown off balance. Antibiotics can wipe out good bacteria, allowing Candida to multiply. Hormonal changes during pregnancy, menstruation, or hormone therapy can also contribute. High blood sugar from uncontrolled diabetes creates a feast for Candida. A weakened immune system increases susceptibility to infections. Douching disrupts the natural balance, washing away good bacteria. Tight-fitting clothing traps heat and moisture, creating a breeding ground for Candida. Now that we understand the why behind yeast infections, let's talk about the how. How can you tell if you have one? Yeast infections come with a telltale set of symptoms, though the severity can vary from person to person. One of the most common and bothersome symptoms is itching. This itch is usually concentrated in and around the vagina and can range from mild to intense. You might also experience a burning sensation, especially during urination or intercourse. Another hallmark symptom is abnormal vaginal discharge. Unlike normal discharge, which is usually clear or milky white, the discharge associated with a yeast infection is often thick, white, and clumpy, resembling cottage cheese. It's important to note that the discharge is typically odorless or has a slightly yeasty smell, not a foul odor. Other potential symptoms include redness and swelling around the vagina, soreness and irritation pain during intercourse, a burning sensation when urinating. If you experience any of these symptoms, it's essential to see a healthcare professional for an accurate diagnosis. Self-treating can be risky, as other conditions can mimic the symptoms of a yeast infection. Section 5. Seeking help. Diagnosis and when to see a doctor. Self-diagnosing a yeast infection can be tempting, especially with over-the-counter treatments readily available. However, it's crucial to seek professional medical advice for an accurate diagnosis. Why? Because several other conditions, some more serious, can share similar symptoms with yeast infections. These include bacterial vaginosis, trichomoniasis, and even sexually transmitted infections. Seeing a doctor ensures you receive the correct treatment. During your appointment, your doctor will likely ask about your symptoms, medical history, and any medications you're taking. They may also perform a pelvic exam and take a sample of your vaginal discharge for microscopic examination. This simple test can confirm the presence of Candida and rule out other infections. Don't hesitate to seek medical attention if you're experiencing symptoms for the first time, your symptoms are severe or don't improve with over-the-counter treatments, you have recurrent yeast infections, 4 or more in a year, you're pregnant, or you have a weakened immune system. Early diagnosis and treatment are key to finding relief and preventing complications. Section 6. Treatment options. Restoring vaginal harmony. Treating a yeast infection is usually straightforward and effective. The goal is to reduce Candida overgrowth and restore vaginal flora balance. Treatment options include antifungal medications and home remedies. Antifungal medications are common and effective. They come as creams or suppositories. Inserted directly, they work locally to eliminate fungus, available over the counter or by prescription. Oral antifungal medications like fluconazole are also an option. Taken by mouth, they work systemically. Consult your doctor before trying home remedies. Popular remedies include boric acid and probiotics. Use boric acid under professional guidance. Probiotics may help but need more research. Follow your doctor's instructions and complete the treatment. Section 7. Prevention is key tips for a healthy vagina. While yeast infections can be bothersome, the good news is that they are often preventable. By adopting simple lifestyle changes and practicing good hygiene, you can significantly reduce your risk of future infections. Here are some practical tips to keep Candida in check. Keep it dry. Candida thrives in warm, moist environments. After showering or swimming, dry your genital area thoroughly. Choose breathable underwear. Opt for cotton underwear that allows air to circulate. Avoid tight-fitting underwear or pantyhose made from synthetic fabrics, as these can trap moisture. Avoid douching. Your vagina is a self-cleaning oven. Douching disrupts the natural balance of bacteria, making you more susceptible to infections. Manage your blood sugar. If you have diabetes, controlling your blood sugar levels is crucial for preventing yeast infections. Practice safe sex. Use condoms consistently to reduce your risk of sexually transmitted infections, which can increase your susceptibility to yeast infections. Wipe from front to back. After using the toilet, always wipe from front to back to prevent the spread of bacteria from the anal area to the vagina. Section 8. Lifestyle choices for long-term prevention. In addition to the practical tips mentioned above, certain lifestyle choices can further bolster your vaginal health and reduce your risk of recurrent yeast infections. Diet plays a significant role in maintaining a healthy vaginal microbiome. Limiting your intake of sugary foods and drinks can help control Candida overgrowth. Incorporate probiotic-rich foods into your diet, such as yogurt with live active cultures, kefir, and fermented vegetables like sauerkraut and kimchi. These foods introduce beneficial bacteria into your gut, which can have a positive impact on your vaginal health. Stress management is another crucial aspect of overall well-being, including vaginal health. Chronic stress can weaken your immune system, making you more susceptible to infections. Explore stress-reducing techniques such as yoga, meditation, deep breathing exercises, or spending time in nature. Maintaining a healthy weight is also beneficial. Obesity can increase your risk of developing yeast infections due to hormonal imbalances and increased moisture in skin folds. By making conscious choices about your diet, stress levels, and overall health, you can create an environment that is less hospitable to Candida overgrowth. Section 9. Debunking myths, separating fact from fiction. Yeast infections are surrounded by misconceptions and myths that can lead to unnecessary worry and confusion. Let's debunk some of the most common myths. Myth: yeast infections are sexually transmitted. Fact: while sexual activity can sometimes lead to a yeast infection, it is not considered a sexually transmitted infection. Yeast infections are caused by an overgrowth of Candida, which is already present in the vagina. Myth: all vaginal itching is caused by yeast infections. Fact: many conditions can cause vaginal itching, including bacterial vaginosis, allergies, and skin irritations. It's essential to see a doctor for an accurate diagnosis. Myth: douching is a good way to prevent yeast infections. Fact: douching actually increases your risk of developing yeast infections by disrupting the natural balance of bacteria in the vagina. Myth: you can't get a yeast infection if you're not sexually active. Fact: yeast infections are not limited to sexually active individuals. Any woman, regardless of her sexual history, can develop a yeast infection. By separating fact from fiction, you can make informed decisions about your vaginal health. Section 10. Your body, your health taking charge. Vaginal yeast infections are a common and often frustrating experience for many women. However, by understanding the causes, recognizing the symptoms, and adopting preventive measures, you can take control of your vaginal health and minimize the impact of these infections on your life. Remember, your body is unique, and what works for one person may not work for another. Pay attention to your body's signals, seek professional medical advice when needed, and don't hesitate to advocate for your health. By prioritizing your vaginal health and seeking timely treatment, you can navigate the world of yeast infections with confidence and ease.